So good morning, good afternoon, good evening, everybody, depending on where you are joining us from. Welcome and thank you for joining today's very important webinar on the role of unifying global targets to accelerate global action on antimicrobial resistance, or AMR. My name is Jeremy Knox. I'm Head of Policy for Infectious Disease at the Wellcome Trust based in London, and I'm delighted to be your moderator for today's session, convened by the Global Strategy Lab and AMR Policy Accelerator. We've got a huge amount of excellent material to cover today, looking at the role of unifying global targets in catalysing stronger, more sustained action on AMR. We have a brilliant group of panelists who you'll see on screen, who I'll introduce very shortly. In terms of how things will run today, we will be starting with some scene setting of why we're having today's discussion, and one of the proposals that is on the table for setting a global unifying target. We'll then hear from our panelists on how this could shape some of the issues affecting the global challenges of drug resistance, and then how we might make progress with taking this forward, taking these targets forward this year. Of course, crucially, we want to leave some time for Q&A from you, the audience. So as we're going along, please do use the Q&A button that you can see at the bottom of your Zoom screen to submit questions to the panelists we can come back to later on in the final stage of proceedings. In terms of some quick introductions to our panelists, so I'm delighted that today we're joined by, firstly, Dr. Mathieu Poirier, who is co-director of the Global Strategy Lab, York Research Chair in Global Health Equity, and Assistant Professor of Social Epidemiology at the School of Global Health at York University in Canada. Mathieu is also a member of the WHO Collaborating Centre on the Global Governance of AMR. Next, we have Dr. Masika Sophie, who is a Global Health Policy Manager with the World Health Federation for Animals. Masika is a highly accomplished veterinarian and epidemiologist whose professional focus has been to demonstrate the value of a One Health approach in system strengthening when tackling complex health policy issues like AMR. And then last, definitely not least, we have Dr. Sujit Chandy, who is Executive Director of the International Centre for Antimicrobial Resistant Solutions, or ICARS, and a member of the WHO Strategic and Technical Advisory Group on AMR. Prior to his appointment as Executive Director of ICARS, Sujit was a Senior Professor of Pharmacology at Christian Medical College, Vellore in India, and the Director of REACT Asia Pacific. So a fantastic panel with a real breadth of experience, and we're looking forward to hearing from them over the next hour. But just to briefly set the scene, why are we here today? Why are we having this particular conversation right now? As I'm sure most of you who have joined us today will already know, AMR is one of the most profound infectious disease challenges facing the world today. We know that already more than 1.25 million lives are lost each year directly due to drug-resistant infections, and then a further 3.7 million deaths are associated with AMR annually. The loss of effective antimicrobials has profound implications for our ability to control and to treat diseases, while the declining efficacy of antibiotics in particular has very broad implications across our health systems, undermining safe delivery of surgery, of cancer chemotherapy, of maternal care, so many things that we take for granted today. The good news is over the past decade, we have seen a lot of progress. We have seen significant mobilization in efforts to tackle AMR. For instance, there's been concerted action from global organizations across the human, animal, and environmental sectors, with an increasingly strong quadripartite approach from the WHO, the FAO, WOA, and the UN Environmental Programme. We've also seen growing political attention on the issue, with AMR very consistently on the agendas of the G7 and the G20. The UN held its first high-level meeting on AMR back in 2016, and the vast majority of countries now have national action plans, or NAPs, in place and signed off by ministers. And of course, we have a vital crop of new organizations and initiatives being developed to tackle the challenges of AMR, like ICARS, which Sujit leads, or like CARB-X, GARD-P, and the AMR Action Fund in the antibiotic R&D space. But the reality is that although we've seen significant progress in that time, there is in some key areas, the world really is not yet going far enough or fast enough to tackle the growing problem of AMR. We don't yet see a consistency in the level of mobilization that's needed across multiple sectors and across governments of all types. We do have the opportunity to change this, though, and in that regard, 2024 is a very big year. The key thing is that we have a second high-level meeting, or HLM, happening on AMR at the UN General Assembly, UNGA, in September. This focus from global leaders provides a huge opportunity to us, and a lot of attention is now turning to how the political declaration that will come out of the HLM might transform the governance of a global response to AMR and really shift it into a higher gear. A key part of this is a move to a target-based approach to tackling AMR, as we've seen in many other areas of global health and climate change, as a means to define what success looks like and then track progress towards that. With an issue as complex as AMR, there are a raft of technical targets and indicators that could be set at a country or a global level. But of course, delivering on all of these in one go in a forum like the UN isn't realistic. And this is where the idea of a unifying global target comes in. The core idea of this, and this is one which Wellcome is supporting as one of our key asks for UNGA, is that the most powerful first step we could see from the UN is not a long list of detailed targets, but a single unifying global target that sets an overall level of political ambition, sets the course for the development of more detailed targets, and provides a focal point, a rallying cry that multiple different sectors can unite their efforts behind. We've seen this approach used successfully in other areas. Many of us would immediately think of things like 90-90-90 in HIV or the 1.5 degrees target in climate change. Neither of these is intended to capture every last detail of a complex set of problems, but rather seeks to set the political direction, unite advocacy efforts, and guide a much wider set of activities, targets, and indicators that come underneath. The question of what that target could and should look like for AMR is, of course, not easy to answer. But back in April, Global Strategy Lab attempted to do just this, convening a group of 20 or so experts working across different sectors globally on AMR, myself and all the panelists included, for a week-long meeting at the Rockefeller Bellagio Centre in Italy. At this point, I'll hand over to Mathieu to talk in more detail about what was concluded at this meeting and really to go into more detail about the idea of a unifying global target and how we might take that forward over the next couple of months.
Thank you so much for that excellent introduction. I'm just going to start to share my screen. Okay. So my name is Mathieu Poirier. I'm co-director of the Global Strategy Lab, and it's my pleasure to present what came out of this convening at the Bellagio Center in Italy. There were 21 participants in early April, and you'll see that we had broad representation from many different parts of the world, and very importantly, from across different sectors, human, animal, environmental, representation from quadripartite, from academia, government, civil society. We tried to really bring together a group of people that would represent the different interests at play when trying to develop these high-level political targets. And our charge for everyone that was convened was to have a target that was relevant, equity-driven, and actionable across all countries and One Health sectors. So something that goes beyond just a human-focused target and is a global level target. It's not pitting one country against each other, trying to see who's doing well and who's not doing well. Something that truly is uniting the world. To go into a bit more detail of what we're looking for. We thought that a unifying global target is intended to mobilize political action to address this immense global challenge. We know that there are many technical targets out there that are accurately measuring some really important steps along the way, but nothing that could easily be communicated to the public by a politician. So we're looking for something that could act as a barometer of global progress across, again, all countries and sectors. We're looking for something that could unite many technical perspectives into a memorable concept that could be easily communicated. And that was really key, that it could be easily understood by a broad cross-section of the public. And it had to be action-oriented to give identifiable moments of success and political wins along the way. We know that this is not an issue that's going to be going away ever. So we need progress indicators along the way that are going to allow us to say, actually, some of these actions that we're taking are working on the global level. And again, this is supposed to be usable by heads of government, by ministers that are speaking to citizens and journalists. Often we're speaking academic to academic, at least in my spaces, and we get to some highly technical language. This is not what we're looking for with this unifying global target. So with no further ado, let me go into what emerged from this process. And it's a tagline, a number, and I'll explain each piece of this as we move along. So overall, together, we can act against AMR to save lives and livelihoods today and safeguard options for tomorrow. We call this the 1, 10, 100 targets. It starts with One Health. We'll be measuring how to save 10 million lives by 2040. And overall, we're aiming to achieve 100% sustainable access to antimicrobials. So let me go into each one of those pieces one by one. And you'll see that this is a framework that has a high-level target at the top. And there's a few different indicators for progress along the way that we're starting to propose. But obviously, this is an ongoing political process. We need to consult with technical experts. So we're proposing a few ways to measure progress, but these are very much still being developed. And please do get in touch with us if you have ideas of how to strengthen it. So first of all, it starts with a One Health approach. We need to protect humans, animals, food systems, and the environment. We think we can possibly measure progress by measuring how secure livelihoods are, and that can be achieved by achieving a reduction in pathogen spread between farms, by having fewer people that are forced into extreme poverty by AMR, and by sustaining biodiversity, for example, by the percentage of land and ocean that's designated as protected. And we heard recently from Prince William that microplastics might be another area of interest here. 10, so 10 in million lives, this is really how we're going to measure progress along the way by 2040. And crucially, this is preventing lives lost due to all infections. This is going to be done by preserving the vital systems and services that depend on sustained antimicrobial effectiveness. So here we're going to be measuring progress by things like enhanced vaccination programs, the percentage of people and animals that are vaccinated, improved wash infrastructure. Again, this is clean water and sanitation for farms, for people, for protecting the environment. And also by doing these actions, we're going to be able to prevent loss in economic productivity. And this might be measured by percent GDP loss averted. And finally, this really is key to the whole thing. This is spotlighting how we preserve sustainable access to effective antimicrobials, 100% sustainable access. We need it available to all. We need antimicrobials to be used prudently, and it needs to be secured for the future through innovation. We think that we might be able to measure progress through the percentage of people and animals that have access to quality assured antimicrobials, through enhanced conservation, so percentage of antimicrobials used that are critically important to human health, trying to minimize that as much as possible, and innovation. By measuring the number of new antimicrobials, vaccines, diagnostics, and social innovations, alternatives that are developed over time to sustainably secure effective antimicrobials well into the future. And I'll just go through one more slide before I wrap up here. So we think that there are a few advantages to this 1, 10, 100 approach. First, it has a focus on prevention. It promotes interventions like vaccinations, water, sanitation, and hygiene to sustain antimicrobial effectiveness while also preventing all infectious diseases. Second, it integrates with the Sustainable Development Goals. So with goals on universal healthcare, food security, maternal child health, and I think I'll maybe go into a bit more detail later on this webinar. It also promotes health equity. So the benefits of this prevention-focused approach most accrue among low and middle-income countries, newborns and children, also older persons, and marginalized communities where the burden of disease is highest and the access to quality-assured antimicrobials is the lowest. It promotes multi-sectoral action, putting One Health first and integrating the health of humans, animals, plants, agri-food systems, and the environment across the 1, 10, 100 components. And I've really been trying to highlight that in those sub-indicators, the sub-targets, we're hoping that they'll be broadly applicable across all One Health sectors. And finally, it recognizes the need for innovation, underscoring the need to develop new equity-promoting diagnostics, vaccines, and social innovations that are a key component of this moving forward. So that is the 1, 10, 100 targets, and I will stop my share and pass it back over to Jeremy.
Thank you, Mathieu, for that very helpful introduction to the idea of a unifying target and for the very kind of the very interesting discussion about the 110 100 target that came out of the Bellagio discussions. I'll turn now to Masika, if I may. I'm interested in your initial reactions, your opening thoughts on what you've seen from Mathieu today.
Thank you so much, Jeremy and Mathieu, for that brief introduction on what the proposal we are putting forward is. My reflections are going to focus specifically on the implications on animal health, food security, and livelihoods, because I will start by saying that by now we already know that everything is very much interconnected, and from the different sectors that you're working on, we've already seen the impact of AMR cutting across all the sectors and all the regions. So what does this mean for animals in terms of the unifying global target? This target provides an opportunity to ensure that the health and well-being of animals are first prioritized, to ensure that they are first optimized. And this is on all animals, but specifically focusing on farmed animals, to ensure that we are reducing the need for unnecessary, emphasis on unnecessary usage of antimicrobials, specifically in the agri-food systems. And this can look like ensuring that we have better management and husbandry practices within the farming industry, ensuring that animals are living within the natural living conditions, coupled with vaccination programs and access to sufficient veterinary health services. As I mentioned, this is all interlinked, and this is very much connected to food security. We all know that a good proportion of the protein consumption globally are from animal origin. But AMR threatens the progress that has already been made to ensure that communities, especially those living within the lower and middle income countries where I come from, are food secure and nutritionally adequate. This is also linked to the livelihoods of these communities and the economic impact that AMR has when we are talking about poverty and communities that are dependent on livestock. So this target provides an opportunity for equity first. Matthew mentioned that there are key 5 areas that this proposal, we see it as an advantage, and health equity was one of them, where we are ensuring that farmers, especially smallholder farmers in low and middle income countries who are very much dependent on livestock, their livelihoods are secured by preventing the introduction of pathogens. And this is linked to what I started with animal welfare and health. Introduction of pathogens within their farms, preventing the spread of these pathogens within the farms. And this therefore prevents or reduces the cost implications and the losses that may arise from antimicrobial resistance if it's not prevented. Therefore, we are trying to reduce the people who will be forced into extreme poverty. As you know, the world is very much dependent on livestock production in different capacities, whether it's intensive or extensive in different parts of the world. Yeah, I will hand it over to Jeremy.
Thanks, Masika. There's definitely really good points there around the kind of the role of, I guess, the One Health angle and the impact of AMR on lives and livelihoods in the agricultural sector, which I'd like to come back to when we get into the Q&A and the panel discussion. But I'll briefly hand over to Sujit, if I may, and same question to you. What's interested in your initial reactions to Mathieu's presentation?
Thanks very much, and thanks to the organizers, GSL and AMR Policy Accelerator, and of course, welcome. Not just for this opportunity here to talk, but actually also for the wonderful time we had in Bellagio discussing these points, which are now presented. I think my initial reflections really is about the term unifying. And we have a lot of targets now being discussed over the last few months, and each has its own relevance and the angle and the need, in one sense, at the global, at the country, and at the sectoral level. But I do now really understand, especially after our meeting there, that there is a need for a unifying target. And you made the point, Matthew, very correctly, where, what can the politicians who finally have to put the money where the buck is, what understanding do they have, and how do they perceive AMR in the competing priorities? And that's why having a simple set of numbers which can mean something becomes very important. So for that, political understanding and political dissemination for them to say something both to the media and to the public, make the public understand what AMR is about. Having these kind of simple numbers which come to the mind very easily is going to be extremely important. And not just that, we know that for the last decades, but especially in the last decade, there's been a push for AMR, but has it percolated to the real population? And for that, the global campaign with an easy set of numbers become very important, really. So with that in mind, I think unifying the globe, unifying the sectors, and unifying people become very important. But if I just want to, before I go a little bit more into human health, because Masiga mentioned about more of the One Health sectors. Let me just say that I think the meaning behind each and not the numbers is equally important. The One Health part is so important now because we realize more and more how interconnected we are with the world around us. The planetary health, the way that animals and us interact, our deep-rooted need for good agriculture and the environment around us to breathe, etc. So I think without that, we should not leave any sector behind. And that's why this unifying aspect becomes extremely important, in my opinion, because then we can truly look at both lives and livelihoods. And this becomes very important, especially in today's world with climate change for agri-food systems and the safety of what we're eating and this pure survival of farmers. The second part is the 10 million lives saved. And again, more than the number, I want us to focus on what it represents, the lives saved. And of course, the Graham study came out in 2019 with 4.95 million deaths associated. But we need to realize more than that, that there are deaths happening with AMR, and we need somehow to save them. And unfortunately, whether we like it or not, many of the deaths falls disproportionately in lower middle income settings, and particularly in children under 5 and elderly. So I think we need to realize that and grasp that 10 million as how many lives can we really save? And this, of course, I'll come back to it, often is not just by stewardship, but also by prevention. And the last thing was on the 100% access. Again, more than the number represents access. Think of access. Access to effective antibiotics. We are moving from when antibiotics were first introduced, maybe from 100% access to effective antibiotics to I don't know what percentage now, because each bug is different and each antibiotic is different. But therefore, when we look at this, let us remember that access is about access and excess, and therefore the strategies need to be complementary with each other. And ultimately, it's about effective antibiotics. It's about equity promoting. It's about ensuring that those in the margins where affordability is a big issue, availability is a big issue, are taken care of. Having said that, let me end by talking a little bit about human health. I think there are a few things which I want to say, which come to my mind at least, and the importance of prevention. We can do so many things. We have various policies saying put up more microbiological labs, do more surveillance. Everything is important. But I cannot impress upon all of us listening here and beyond the importance of prevention and how costly it will be if we don't prevent. And therefore, vaccines, and especially in the low middle income countries, WASH becomes so important. The real question is, are governments able to support these strategies? And do they understand the need? I think they understand. But the real question is how much they're doing about it. The second thing is the access versus excess issue. And I did talk about affordability and availability. But coming to stewardship, really speaking, we talk about stewardship, but often it's tertiary care stewardship. How much are we doing in the primary and secondary care level? And there, of course, the problem is labs, capacity, and resources, and the whole financing issue. And that's why we need alternative strategies here. Context is important. We can talk all we want. Therefore, the targets should really reflect context-specific issues. But is it easy to put those targets there when we have unifying targets? My answer is yes, we should have these unifying global targets. But using that as a pedestal of what each number means, then we move to what the countries need, what the sectors need, and what are the implementation factors, the solutions, and these become the key issue. So with this unifying global target, my plea is that we use that to move forward with much more momentum. And that's what my piece is, Jeremy, and I hope that it's very clear. Thank you very much.
Thanks, Sujit. That's great, and I think definitely the really kind of good to have that type of rallying cry, and some very good points there around the politics and how kind of how the negotiations around targets at the UN could be affected by politics that I'd like to come back to. But if we can open it up now to the wider panel. So Sujit, you were just talking there about the importance of prevention and access as being really an integral part of the AMR problem. I wonder if Masika or Mathieu, if you wanted to say anything more about your perspectives on the importance of prevention and access, especially in an LMIC context, and how that's represented in the concept of the unifying targets.
Thank you, Jeremy. From my perspective, coming from a lower middle income country, I know that prevention is and we all know this, prevention is a very fast, crucial step in any prevention preparedness pathway. It provides an opportunity for equity because you're preventing the challenge before it happens. So everyone has an equal opportunity to be in the same playing field. And this is what the foundation of this proposal is: prevention first before we go into any response that may be needed down the line. So from an animal health perspective, prevention looks like preventing first the drivers of infectious diseases within the animal health sector, within the food security systems, within the livelihood sector, preventing infectious diseases from occurring first before we have to deal with them. And this also brings an issue of we're talking about reducing the usage of antimicrobials, but we also need to understand that merely limiting the use of antimicrobials within the animal health sector isn't really solving the problem. The real issue is tackling the drivers before we deal with reduction of antimicrobial use within the animal health sectors. Because if we limit the use of antimicrobials without dealing with the drivers, we risk the health of the community, we risk the economic stability of the farms and the livelihoods of farmers and food security. But we also need to strike a balance between providing access to appropriate antimicrobials, as Sujit has said, and restricting the inappropriate use of these critical antimicrobials from especially communities or countries within the lower middle income countries, because most of these countries do not have access to good quality antimicrobials in the first place. So we need to ensure that the quality of antimicrobials being availed to these countries is of good quality to minimize the usage of substandard antimicrobials, which are further propagating the issue of AMR in these regions.
Yeah, so maybe if I can build on that really excellent answer. And Masika, I think this really shows that the power of these goals and showing the synergy between action on AMR in the animal sector and the human sector, because everything you're saying, I'm just going to more or less repeat, but with a focus on human health, the prevention focus and ensuring access is also just as important in human health as ensuring the health of animals and communities that rely on them. So we know that right now there are something like over 5 million people that die every year from lack of access to quality assured antimicrobials. And as of now, by some estimates, that's actually more people than are currently dying from directly attributable to AMR. And so that emphasizes the need to expand access immensely to address this urgent challenge. And one thing that I've heard in developing these unifying global targets is that other targets have been put forward that focus specifically on AMR attributable deaths. And we're taking a more AMR sensitive approach with reducing deaths due to all infections. And I think one of the main reasons we've chosen to do that is that you can just reduce AMR attributable deaths down to close to zero by restricting access to antimicrobials to those that need it. And deaths will go up due to that lack of access, but AMR attributable deaths will go down. And so that's why this focus on prevention and on expanding access that's built into our unifying global targets is so key. And again, as Basika really highlighted extremely well, this works for human health as well as for animal health, for the environment, for entire communities and livelihoods. And I think it's really important that we focus on upstream interventions, things like equity promoting vaccinations, access to water, sanitation, and hygiene. But we know that these are going to be expensive propositions, and expensive interventions will require us to go outside of ministries of health and up to other ministries of finance, as well as to leaders of government. And this, again, goes to the importance of something that's easily communicated to the public, that a prime minister can go in front of a podium and say, we are going to achieve the 1-10-100 targets. And I know that we came into this process with some ideas of using disability adjusted life years or other more complex measures. And it really came through clearly that these complex measures are great for measuring things in academia and internally. But for the public, even understanding a percentage reduction of deaths or deaths due to a certain cause, this is going to take way too much explaining if you're in front of a podium. So that's why we've chosen to focus on exactly how many lives are going to be saved. And we think that it's highly achievable to actually save 10 million lives by 2040.
Thanks. I think that's a great explanation, Matthew, of a really important point for me. One of my learning points was around how to be able to conceive this as not just saving deaths, but saving lives that are being lost to AMR, but thinking about the wider benefits, that wider dividend, if you like, of that can be gained from taking action on AMR across the full range of infectious disease challenges. Masika, if I can come back to you. So one of the other things we discussed a lot at the Bellagio meeting was the One Health approach and the tension that we see of often a lot of targets in the AMR space, or targets that are put forward, being very human centric. And I wonder if you could explain from your perspective why that's a problem, and why the 110, 100 approach, why this idea of a unifying target is fundamentally different.
Thank you, Jeremy. I think we are still adding on the same points that Matthew has said, is that the issue with looking at AMR as solely a human-centric problem is the fact that we fail to recognize that probably AMR is going to be one of the most complex global health issues that we are going to face as a generation. And if you look at it from that angle only, we are definitely going to create solutions for this problem only from one angle. This is basically pouring water out of a leaking boat, hoping to solve the solution. So what this goal is doing, and even from the 110, 100, and Sujit has explained that really well, one being not just the One Health approach, but also the unifying and bringing everyone together and making sure we're not leaving anyone behind, is that this goal acknowledges the multifaceted nature of that AMR is. And therefore, it creates solutions emphasizing that AMR is not only a human health issue, but it affects the animal health as significantly as it does the human health, the environment health, and every other sector, every other moving part that AMR impacts, be it the economic part of it, access, livelihoods, food security, financing, the innovation and technology, WASH, and market dynamics. This is what this proposal is looking at. And even from the animal health point of view, there are even more moving parts within the animal health sector in itself. Are we looking at health? Are we looking at welfare? Are we looking at vaccination first? Are we looking at movement away from activities that are drivers of antimicrobial? So this goal provides an opportunity for us to look at it from a 360 degrees, where we are not just facing the front.
Great, thank you. And Sujit, if I can come to you now. So some people might say this is all about just the UN system, just setting global targets. That's not actually going to change anything at a national level. I wonder if you have any thoughts on actually how these sorts of unifying global targets could actually support and affect country level implementation of national action plans.
Yeah, thanks, Jeremy. I think it's a complex issue, really. As I mentioned earlier about, there are now kind of targets being disseminated or discussed at various levels, which include more science-based technical targets, more political targets, and then you have the unifying targets that we're discussing now. I think each has its relevance and role, but I think the countries, if you really need to move forward with the countries, they need to understand what it's all about and make sure that it doesn't get confusing for them. And that's why these three elements, if I can put it that way, become quite more clear for them, if I can put it that way, that they have to focus on One Health. They have to focus on saving lives and livelihoods, but they also have to ensure that there is access to effective antibiotics. But having said that, I think some of the real difficulties for the countries would be the fact that the ministries often work in silos, and therefore the funding is in silos. The second challenge probably is going to be the whole issue of evidence and surveillance within countries and country contexts. And we do know that there are a lot of countries who are really lagging behind in this, not because of their fault really, but because they do not have the resources, both from financing point of view, expertise point of view, and beyond. The third is even within countries, you have vast disparities between urban and rural, private and government. And therefore, when it comes to data monitoring and setting up things, there are huge challenges out there. I think, but this is where I think it becomes very important for countries when they look at all this, setting targets based on what they think is achievable, but therefore it becomes more accountable. Accountability and transparency therefore become extremely important. If there's something which they really can't achieve and they stop doing it right from the beginning, or they're not able to do it and therefore, but they try to show that they're doing, becomes an issue. The second, I think, in this respect, is that we need to be sure that whatever they're doing, it is top down and bottom up. Because if they're not able to do this, I think the targets will not be achieved, whichever target is. Community engagement to me is key. And when I say community engagement, it means many things. It includes stakeholders, every sector, every stakeholder on the ground. They know much more than even we know the challenges on the ground. So if you really they need to be understanding what these targets are. And they have certain expertise and knowledge and experience. How do they translate that is going to be the key issue. And that's where we have to help them. The third and last point is the context. The context and getting the solution based on the context if you really need to achieve the target. And that's why I think this target really has to be in building blocks. We have the unifying global targets. We will probably have another set of targets which are science and technical oriented. But the building block targets right at the bottom, that's something which I think each stakeholder, each sector, each community has to understand this whole thing and then set their targets. And that's something which, once they put it, their ownership is theirs and therefore probably much more achievable.
Thank you, Sujit. We're getting lots of questions in. So actually, I had a few more questions for the panelists, but we're going to segue into taking some questions that have been coming up from the audience. And actually, my first question that I will put to Mattia was actually already on my list, but it's been asked by Garda Zubayan. And it's about the link with the SDGs. And obviously, we know the SDGs are already in place. They are set to run out in 2030, but obviously 110, 100 has been set towards a horizon of 2040. So I wonder if you could say a little bit about that, Mattia, and how you see those things fitting together.
Yeah, thank you for that question. And it's certainly something that we discussed as the Bellagio group. The main reason that we chose 2040 rather than 2030 is that by the time anything gets adopted at the global level, filtered through national levels, gets implemented, really we're looking at a couple of years down the road, and then a few years after that before we start being able to see some measurable impacts of some of these actions. And we thought that just not enough time to achieve what we know needs to be achieved by 2030. So we set 2040 as a medium-term horizon, 15 years to achieve 10 million lives saved and towards 100% sustainable access through a One Health approach. And we think that's a good medium-term horizon for these unifying targets. But obviously, that doesn't mean that we have to wait until then to start acting. And actually, I think one of the main strengths of this approach is that it aligns really well with existing SDGs and other approaches. So the obvious one is SDG 3, good health and well-being. I'm not going to start listing off all of the numbers of deaths due to different resistant infections around the world, but we all know it's a massive problem. It also aligns, though, to achieving no poverty, to achieving zero hunger, reduced inequalities because of the One Health approach we're taking. So, for example, we know that the economic impacts of resistant infections could reach $500 billion by 2035. Healthcare costs are going to increase probably more in LMICs and high-income countries due to resistant infections. AMR might push something like 30 million people into extreme poverty by 2050. And livestock production might decrease by something like 11% in LMICs by 2050 due to resistant infections. So all of this just highlights the cross-sectoral issues and the connections to different SDGs. And the fact that we're able to tap into existing resources and attention to these issues by 2030 is just going to help us accelerate progress into the following years as we look forward to 2040. And that's not going into other things that there's really strong connection with, such as universal healthcare, the global plan to end TB, Convention on Biodiversity. There's many other connections we could make, but I think the connections here are one of the strengths of this approach.
That's great, thank you. I'll move on to another question now. I'll actually group a couple of questions from the audience, from Isa to Psar together. So to all panelists, I think really interested in the question of how can progress towards achieving global targets like this on AMR be monitored, measured, and evaluated? Do we have the data we need to do that? And I guess linked to that is what accountability mechanisms are needed to make sure that countries are making progress and that they're fulfilling their commitments to take action against AMR. Open to any of the panelists.
Yeah, I think I'll take a quick start on that. I think we have to acknowledge that data points and the whole issue of evidence is often a bit topsy-turvy, where HICs have much more and LMICs don't have that much. And we realize some of the factors which are leading to this. And that is why I think what ideally needs to happen is that each country obviously has various strategies in place which are more AMR sensitive. We need to quickly have a look, really, or each country has to do an analysis on where they're at in terms of that. What are the optimal strengths and what are the weaknesses, and how they can plug the weaknesses. And they already have, let's say, a budget allocation for some of these programs, which could, for example, be vaccination, or it could be, water systems, whichever ministry it comes under. And then there are, of course, the more AMR-specific interventions where, data may be there, data may be lacking. And I think what is important is to have a quick analysis, each country and within each region, as to where are the gaps and where are the critical gaps, because then we know what we're dealing with in terms of each country and even within the countries. What then needs to happen really is, how can the country support? And if the country cannot support, how can someone else support? From a data point of view, the biggest problem, I think, is that we tend to collect too much. What we should look at is ensuring that we have X number of targets which are critical. And in the high priority targets, we start strategizing on how we can collect it in the most cost effective manner. And this is where sampling and sampling size become extremely important, because the moment we try and create a wide platform, there'll be noise, but rather the signal, it becomes weak. And I think if we strategize in those aspects, we could have that. Lastly, I think the economic case, as someone pointed out in one of the questions, become extremely important. Whatever we do, whatever intervention we make, we need to document the challenges, the barriers, and the successes. But most importantly, how much does it cost? The cost of action and the cost of inaction. If we start doing that in these countries, I think then the politicians and the policymakers will actually invest more and more, because they know that something is succeeding.
Great, thank you. Mattia or Masika, do you have any thoughts on how to measure progress, how to ensure there is a follow-up mechanism that can track progress?
Well, maybe just quickly, I'll add that one key additional component we haven't gone into much detail on yet is the need for an independent panel on evidence for AMR. At the global level, there's going to be a massive amount of evidence coming out of many different countries. There's going to be new academic studies. And we right now have no real systematic way to wade through this evidence and provide recommendations for countries on what's working, what's not working, and how much progress we're making. So one really important follow-up action to whatever comes out of the political declaration, whether we adopt these targets or not, is the need for an independent panel to adjudicate and synthesize all of this evidence.
No, I very much agree. We've seen that that's had a real effect in climate change with the IPCC. So I think having something similar that can, as you say, make sense of a growing body of evidence on AMR would be hugely valuable and provide a kind of fit into a coherent, more structured governance system going forward. I wonder if we could turn now to another of the questions around, and Sujit, you talked about multi-sectoral collaboration, and there's another question in here around what strategies can be implemented to promote multi-sectoral collaboration and data sharing to combat AMR across domains, and I guess how could that be supported by a move to a target-based system, by the establishment of a unifying global targets. I wonder if any of the panelists have views on that.
Thank you, Jeremy. I think I will take that. We did have this discussion a lot in Bellagio, and one of the things that really came out strongly is the need for effective governance, because at the national level and the regional level, it's very difficult to integrate different systems that have been used to working together. So ensuring that the governance of issues that require One Health approach, for instance, the AMR, are placed at a higher level within the governance structure in a country level, for instance, where there's room for integration of the data, of the information sharing between the three sectors, this animal health, human health, and environment health, because it's very difficult to change an already existing system, but it is easier to create a new governance system within the national mechanisms to allow for the flow of information between the three sectors.
I think one more aspect in this is, my opinion is that long back when when One Health concept became a bit strong, and this is probably around 2017, I actually had a meeting of farmers, doctors, environmental people, agriculturalists all together. It didn't turn out as well as I expected, but then I realized that I had made a mistake because we were trying to create solutions, but first of all, there needs to be understanding of the problems that each sector has, and awareness that this is a much larger problem than one sector. So invariably, it became a blame game. So I think the first level is from a horizontal point of view, it's not about integration in that sense, but it's about understanding each other's problems. And the second is not to blame each other. because really the problem is much larger than us, right? So once we have that, I think the way that the countries are working are not horizontal, unfortunately, in terms of integration at least, but it is often vertical pillars. And therefore, if we try and spend a lot of energy trying to make everything fantastic and perfectly integrated, I think we're losing time. What we have to do is strengthen these pillars, but make sure that there is horizontal interaction so that the awareness, understanding is there. And thirdly, the coordinating mechanism becomes important between these ministries and between these sectors. If we don't have some kind of a coordinating mechanism, then I think we are in for trouble, because we will start from the funding allocations or from other issues, we will start having friction. And therefore, there has to be some level of coordination. That's where many countries are lacking. We need those coordinating mechanisms. Lastly, I think, if I may say so, if you need to move forward, again, let me re-emphasize that I think we should not leave any sector behind. Each sector has a different challenge, but each sector, the cost of action and inaction are different. And we need to understand that between the sectors. If we don't understand that, actually, we will not move forward. That's very important to me. Thank you.
Thank you, Sujit. We'll try and we've got time for about one more audience question. So again, we've got a lot, so I'm going to try and merge two together. So there's one question in here around the 100 part of the target, and do panel members have some views on the effective strategies that could be applied to achieve that 100% access to effective antibiotics? And then alongside that, from Liz, the point around stewardship and how to make sure that appropriate use is being applied in the human and the agricultural sectors, whilst kind of moving towards that. So I wonder if there are any thoughts on that, the 100 element of the strategy, and how to move towards that.
Okay, let me jump in then. I think I have a huge issue here in terms of each context that I've experienced has been different. So 100% looks very, very far away. But we have to start somewhere. And I think so, therefore, the key thing here is understanding what are the barriers there. And one of the barriers has been, unfortunately, livelihoods. Whether it's in the human sector or in some of the One Health sectors, it has been livelihoods. Where, for example, in the human, I can say, if we can say, let's do a culture and susceptibility test. Let's see the doctor first. But that's not how it works in real life. If they spend 3 hours at the doctor waiting for the doctor, and then they lose that day's wages, or by the time the 72 hours is up for the blood and susceptibility culture test, they have to pay double the cost of an antibiotic. And therefore, these are going to be huge issues, no doubt, when it comes to people's money and that. But that's where innovation, and I say innovation in two different ways. R&D in its true sense, whether it's diagnostics or drugs, but also let's look at context-specific innovations where there have been experientially alternative strategies for prevention of infection and other things right out there in many of these places historically. What is the evidence is what we need to look at, and how we can uplift that evidence in today's world. And I think if we can do that, we will have many more strategies than we currently have in order to make sure that there is this 100% sustainable and effective access to antibiotics.
Fantastic, thank you. Matteo or Masika, any brief comments before we go through to the final closing thoughts?
Yeah, I will add one last thing to add on what Sujit said. In terms of ensuring 100% access to good quality antimicrobials, and especially for the low and middle income countries, we need to start looking at global health issues as truly global health issues, like AMR. When we provide access to good quality antimicrobials to the global north, we also need to ensure that that is also provided to the global south, because if we do not protect each and every one of us, like Sujit said, it's AMR is an issue for all of us. So all of us have an opportunity to feed in different ways, in different capacities. So we need to look at it globally in its true global sense and make sure that no one is truly left behind.
Thank you. Mathieu, any final thoughts from you before we start to wrap up?
Oh, hard to go after that excellent comment, Ms. Sika and Sujit, but just for those of you in the audience who maybe haven't heard terms like AWARE quite yet, I think this is where it comes through very importantly in the sub-targets to ensure that we sustain access and ensure stewardship over time. I've heard that there's also progress on developing AWARE standards for animal health, so this is key to ensuring sustainable, effective antimicrobials moving forward. But again, we're focused on the political level. So 11000 is going to be way more easily communicated by prime ministers than which AWARE classification are we in. But that's still a fundamental part of what we have to do.
On mute. That's great. Thank you. We are going to run another very quick poll to kind of try and see whether we've been able to change views or inform everyone during while we've been going on with the conversation there around a unifying global target. I'm sorry we haven't had time to get through to every single question that's been raised. It's been fantastic to see so much interaction and see so many great questions coming forward. We've tried to answer them in writing as well as with the panelists where we can, but sorry if we didn't get to your question. I think we've heard a huge amount from all of the panelists and some fantastic insights so far from their different perspectives. And I think to build on Mathieu's point there, we're at a really crucial moment in terms of AMR and the UN process and what that means and what that can potentially deliver. The targets are a huge part of that. We also heard about the independent panel, the evidence panel to help governments guide their action on AMR. And of course, we talked about follow-up and accountability mechanisms as well. All of these things will be really important, but they're going to be very difficult, very crucial negotiations happening in New York over the course of the next couple of months before the meeting in September. We've had a fantastic global audience here, so please be where you can, be talking to policymakers in your country, be talking to people about this so that they understand why it's so important and why it's kind of so vital that we get a step change in the global response to AMR through the UN. We're coming up to time now, so thank you very much indeed to everyone for joining today. Thank you very much indeed to the panelists and to the organisers from Global Strategy Lab, and look forward to continuing to engage with so many of you across the AMR community on this issue over the next few months and beyond. Thank you very much indeed. Bye now.